Welcome to the Startup Grind.
Our guest, I am super excited about Niall Wallace. He started Infonaut in Toronto, moved to Buffalo. He's in the healthcare field. He's had some success. He's continuing to grow, and he's doing it right here in Buffalo. So let's give a round of applause for Niall. You gotta sit over there. It's kind of the feng shui of the event. Welcome.
I apologize for being overdressed.
No, it's okay.
I had a big meeting today, and I never got a t-shirt.
Okay, we're gonna start like that. All right.
Start again.
Take a step back. Niall, tell us about your startup, Infonaut. What do you do, and how the company got started?
So Infonaut's a company that I started in Canada with a co-founder back in 2006, and we built a platform. This really convergence of healthcare IT and what we've discovered in patient safety innovations to stop the problem of hospital superbugs. And we're very interested in solving this problem because it's the fourth leading cause of death in North America. A lot of people don't know that. It kills more people than breast cancer and car accidents combined. 1 in 20 patients going into a hospital will acquire an infection in a hospital. About 100,000 people in the US die every year, and it costs us about $45 billion. And what we've seen is that when we start looking at the problem is that nobody really had a solution. And being from Toronto and Canada is an interesting place to start a business. We had an experience during the SARS crisis when I was working in government. I was working for the Ministry of Health, a very different system there. But we had a perspective on what was a really dramatic and critical disaster where we came about, I would say about 2 weeks away from closing down the healthcare system. We had this invisible problem that nobody knew what to do with. And if you could think about recently, sort of the scare around Ebola, when there's 3 cases in the United States. I think try living in Toronto when there was 300, 400, 500 cases, and all of your healthcare workers really had to be assumed that they were exposed and were in quarantine, and we almost shut the healthcare system down because there was nobody left in hospitals. So that gave us a unique perspective on how serious really an invisible unknown crisis could be in healthcare. And we developed an expertise in tracking infections, and we took that into a hospital. And really we started out with the premise because really nobody knew what was going on. The first question we asked ourselves is, how do infections move throughout a hospital? And about a year later, we were able to answer that question. And from that, once you know how infections move throughout a hospital, and you realize that nobody else is looking at the problem the same way, we said there's a business here, we can really focus on it, and since we know how they are moving around, maybe we can stop them.
So you're talking about invisible diseases that almost shut down the Canadian healthcare system. That's like a huge problem. Were you ever daunted by that? Like that's, you're not trying to improve somebody's bottom line. Like you're trying to save lives. How do you face that challenge as a healthcare startup?
Well, I think this is really the role of the startups themselves. You've got these big companies that are in the healthcare space that are making incremental improvements to the way that, and I'm in healthcare, the way that healthcare is delivered. So for a startup or somebody in the startup space that's got a good idea that's thinking they're going to come into the space and make things a little bit better, you're up against the gun. Like how do you compete against GE by making things 2 or 3% better year over year and living off a profit margin because you've already got an install base, blah, blah, blah. The role of the startup is to think big, be disruptive, take a very different view of the problem and how to solve it, and then stick to it and really kind of live that startup experience by trying to make that difference. And when we looked around, really sort of what we saw is coming out of SARS is that every time there was a crisis, the hospital CEO would get in the front page of the paper or the TV and say, "We're telling our staff to wash their hands more." And we knew right away that cannot be the only answer. That we weren't even sure if that was the answer. And so we went in and we measured the hell out of the problem. We had this crazy technology where I came from a world where we figured out how to track diseases on a map. And we said, what if we can track diseases on a floor plan? And so we would go into hospitals, we set this massive kind of sensory network, you know, the Cadillac of sensory networks, get accuracy down to about 4 inches, track patients, track staff, track mobile assets, and really kind of track those digital breadcrumbs. You talk about huge data, these thousands of things were pinging every couple of seconds, and it became like a game of Clue, where when you follow things back and we analyze this thing and really understand where the infection came from, what were the contacts and interactions to start that, and once you understand all that, how do you break that chain? Like, how do you play the game of Clue and say it was, you know, Professor Plum with the hammer in the OR? And that really kind of started the challenge for us.
So you've recently moved to Buffalo, yourself, and then also Infonaut. Kind of talk about that process, how that happened, and why did you move to Buffalo?
Being a Canadian healthcare entrepreneur is great, and it sucks. You're in the space. You've got a very different healthcare system. You have a single health payer. You've got the government that pays for all healthcare. So in the space, you essentially have one client. And Canada is a remarkable environment that allows you to experiment a lot. There's lots of money available for a 1-year trial, you know, a $50,000 pilot, you know, a link with a university that will let you do something interesting on an academic level for a year. And that's all really interesting to start with. And it gives you space to think, well, a lot of really smart people in the community, and Toronto really is an amazing city. And then, you know, I've talked before, maybe not in Buffalo, but I've talked about sort of the challenge of it being an entrepreneur. And is anyone here a South Park fan?
Oh, yeah.
Okay. So there's a South Park episode where there's a bunch of underwear gnomes. So the underwear gnomes, all the boys, their underwear goes missing in the middle of the night. And they stay up one night, and there's a bunch of underwear gnomes that come into the room, go into their closet, steal their underwear, and so they follow them back to the gnome lair. And in the middle of this gnome lair, there's this massive pile of underwear, and they go, "Why the hell are you stealing our underwear?" And they said, "That's really easy. Step 1, collect underwear. Step 3, profit." And they go, "Well, what's step 2?" And they go, "Hey, what's step 2?" And they go, "Step 1, collect underwear. Step 3, profit." So you're this Canadian entrepreneur, you've had a bunch of great ideas, you've been given enough runway and rope to hang yourself where you've got, Jesus, we've built the greatest technology alive, we can track infections. Profit. And everybody there skips step 2. So when the grant funding dries up and people get a little sick of your step 1, step 3 story, you really have to think about step 2. And you're in an environment where there's a single payer, everything's done by RFP. And I think this is the second challenge for an entrepreneur in the healthcare space. If you're looking for RFP responses, who the hell puts out an RFP for something that hasn't been invented yet? It doesn't exist. Like, it's not, an RFP didn't appear one day that said, give me the craziest idea to help track and stop hospital-acquired infections. What we were seeing was the same old, same old. We need a system or people that can help count how many times staff wash their hands. So, you know, we realized that we could either spend 2 years convincing a hospital to take a flyer on us, and then I had the unique opportunity to meet Dr. Nick Hopkins, I think one of the most amazing people in the Buffalo community. If you don't know who Dr. Hopkins is, he was a surgeon, he's now head of the Gates Vascular Institute, and he really is a gem in the community. He's recognized as the father of non-invasive neurosurgery, and his home is here in Buffalo. And he has attracted a team of the brightest, smartest brain surgeons on the planet that live and work in Buffalo. And And if you want an intimidating conversation, go meet a bunch of brain surgeons and try to convince them that you're a rocket scientist. It's the only way that you can have sort of a level conversation with them. So he, with what he's done is amazing. He's moving towards the end of his career. He's done all of these amazing things in neuro and vascular science, and he's thinking more about sort of the end goal of everything is really the outcomes, is patient safety. They've got a problem, and I think it's well recognized that hospitals in this area really do suffer nationally from, in any comparison you do, from the problem of hospital-acquired infections and superbugs, which literally, if it doesn't make you very, very ill for a long period of time, it'll kill you. And here was this Canadian company that just came down, started knocking on his door and said, we've got a crazy solution, we've tried it out enough, we've published the hell out of it academically and otherwise, and we think we know what we're doing. We need a shot in the US market, we want to find a home for this, and we're tired of beating our heads against a wall in a market that keeps on going, wait for the RFP. And he was an amazing person, listened to us and helped facilitate what was essentially our first large-scale pilot here in the United States about a year ago. And we've gotten to the point where the results from that are remarkable. The learnings from us as a company are remarkable. So encouraging all the way through that we made a big step, and we said, okay, we're on to something. Let's add fuel to this rocket ship and really be rocket scientists. We brought on a CEO from the Buffalo area, which is amazing. And as a CEO, co-founder, I've got an amazing opportunity to not take a back step, but take a side step and really be at the table with a very experienced group that really knows what they're doing and has done this before. So sort of a sweet nirvana spot for a co-founder to be in. So we got results, we got a paying client, we got a strong management team, and we've got a vision to really kind of grow, which is essentially step 2. So we're ready to sell underwear, and profit will come later.
So you talked briefly about the medical community in Buffalo. We are on the Buffalo Niagara Medical Campus. So what is your thoughts on medical campus, specifically focusing on medical technology? What do you think about that?
And I've come to know a lot about Buffalo and learn a lot about Buffalo over the last year and a half. I think as a Canadian, I knew as much about Buffalo as kind of many Americans know about Canada, which wasn't a whole lot. It was a point that we kind of passed through. I literally came down here and camped out at the hospital for, I would say, a period of 7 months until somebody gave me a contract, and I think it was a contract just to kind of say, either go away or you're obviously not going anywhere. We got to keep you around. And I think Buffalo is copying a model that has been very successful in other markets. Like Pittsburgh is an amazing example of a rejuvenated, reborn community. Cleveland, to my huge surprise, was an amazing community to visit, and they've really kind of developed a lot of their community around the presence of sort of a world-respected healthcare institution, the Cleveland Clinic, and everything that brings to the community. So I think it's a remarkable opportunity. You've got, I think, to fly the Canadian flag, you've got an amazing opportunity being a border city to pull in and attract a lot of companies like me, where you've got well-funded, well-developed, great healthcare technology, processes, devices that can't find a home in their home market, but have already essentially, a lot of the hard work's been paid for. So I think that is something you can really take advantage of. And so you're going to have a lot of Canadian competition down here soon, but I think that's a great thing. It's going to spur a lot of great thinking and challenges that are going to come out of it. And healthcare and the smarts and the people involved in healthcare really come from a lot of different disciplines. I think if we were a room full of people that were just healthcare folks, it would be a really boring conversation. There's an amazing book by a guy named Stefan Johansson. It's called The Medici Effect, which talks about the Renaissance was really born by kind of the wealth of the Medici family. Were able to say, I'm going to bring artisans from France, I'm going to bring painters from Italy, stonecutters from the UK. They were able to attract all of these different disciplines into a space, and then really kind of challenge them with a problem, which was, advancing art, advancing society, and be able to pay for it too. That was an important thing. And the lesson learned from that is, in what we've tried to do previously as a company, is you don't necessarily need healthcare experience to make a big difference. In fact, it's a huge advantage if you've solved problems in other industries to bring that perspective in, to be around the table with really smart people in healthcare and come up with novel and neat solutions. And what Healthcare 2.0 talked about in kind of bringing what I've seen before and what's happened really well is you bring a lot of doctors or healthcare professionals with the problems, and you bring a bunch of people from other disciplines that are coders or they're interested in sort of the business models or process flow. You put them all in the room and you get so many different perspectives coming together. You get something that's really quite different and amazing that comes out on the other side that healthcare alone won't think of. And healthcare is this neat industry where I would say it's probably about 10, 12 years behind the technology curve. And so it's ripe for change. It's got so many problems inherent in the system. It's a high-cost delivery system that's very complex. So it's something that's going to benefit from a bunch of different perspectives. So with what we do and being so different in how we approach things, that having not the typical healthcare approach has really set us apart, and it's a competitive advantage. When we look around at all these healthcare companies that are trying to address the same problem, it's the same old, and we're worried because they're all better at grabbing budget than we are. We're not so worried in terms of we don't think that they're close to kind of cracking the nut and cracking the problem the same way that we are.
I think you had a really great perspective there on you can't just have healthcare. So Don, I hope you took note of that. Health 2.0, make sure you have some other folks in there. I think you do, so that's a great observation.
Widen the lens and pull in as many people as you can. There's so many different perspectives that can help health. And health is one of these industries that exists kind of despite the problems that are there and being very obvious. And there's so many problems in healthcare that initially people are going to you're going to get a shrug of the shoulders. It's like, hey, you run a busy hospital or you run a long-term care or a home care system. That just comes with the territory. This is a complicated business. Don't try to tell me how to work it out. There's so many pressures on the sector now, certainly around dollars, but more so in quality and safety, that they're being forced to think outside the box. And if you're running a busy hospital or healthcare company, you don't have time to think outside the box. What you do have time for is to listen to new ideas, hopefully, to evaluate those. And I think the challenge that every healthcare startup is going to have, and really what Buffalo's challenge is to get those healthcare providers in the area to support the new ideas that are coming forward. And that support really means give them some money to do what they do and give them the rope to hang themselves. And and hopefully that'll work out.
Shifting focus slightly from healthcare, in general, what advice would you give an early stage entrepreneur, regardless of the field that they're in? If you had to go back and do it again in your entrepreneurial journey, what advice would you give somebody in the early stage?
Yeah, so entrepreneurship, and I know that every MBA school or university with its salt now has an entrepreneurship program, and I think that's good to a degree. Entrepreneurship for me is really more of a gut check. It really is 99% perspiration. And I've got a great story. So at Mars in Toronto, which is sort of like the super dig of Buffalo, and JI and everything combined, it really is it's a temple to innovation. We've got a great coffee shop, which has kind of become the meeting place where all the entrepreneurs go because the Wi-Fi is free, the coffee's pretty good, and occasionally you run into people with money there. And the owner or the manager there, I saw him I think about 6 months ago, and he goes, you know, we have a unique perspective here. We see all these people come in, and Mars has done a great job of saying, want to be an entrepreneur, we're here to help. So it's really a convergence point. So you get a ton of people coming in the door, and the excitement for the first 3 months is palpable. You know, there's high-fiving at the table because you got a great PowerPoint, and you change some words around and so they make sense, and you're going to solve the problem of quality. And then, after that, you haven't been paid for 3 months, so sort of the reality starts to set in. You're not ordering the croissants anymore. You're not having the Americano. You're just having straight coffee. The despair sets in around month 7, and people start to fall off, and then you're never seen again from month 9 onwards. And he said, we see all these people come in, and there's this cycle to it. He goes, God damn it, there's a few of you that have been around here for a few years. And you always kind of look the same, your tone's the same, you're kind of over that happy stage. But you guys are really gut checking it out. And the people that notice it are the baristas, because you show up and you keep showing up. So for me, entrepreneurship, it's a wonderful experience. It's really creative. God damn, is it stressful. It's horrible sometimes, but the highs are really high. But I think the secret to being an entrepreneur is the gut check. And you're not going to get a sale in 3 to 6 months, especially in healthcare. In healthcare, it's going to take you, you're going to invent whatever you're doing first. You're going to go out and sell it before it's done. But step 2, and the shortest step 2 is ever going to take is going to be 18 to 24 months. So my big regret as being an entrepreneur, and what if I was to kind of be a mentor to somebody right now, is how you take that 5-6 year Infonaut experience and make it 2.5, which is why VCs love to fund management teams that have done this before. They love to fund people that have done it before, even though they've failed. Because we all make mistakes again. Some of us make them 3 times. And that really extends the cycle out. And the advantage to being in a peer network community, to having mentors around, to having a place like Dig, to hang out and chat, and Healthcare 2.0 to talk to and meet people, is really the value is like make less mistakes and take that 5-year journey down to 3, 2.5 if you're really lucky. But if you're not prepared to kind of gut it out and over a longer period of time, it's a natural filter that will just automatically deselect not the ideas themselves, but the people who are driving the ideas.
So never give up. Or
give up early.
Save yourself
a bunch of heartache.
Oh, geez. I've got 2 conflicting things. Have a automatic or right away, or never give up?
Well, if you've got some honest friends or honest company or honest mentors, really your question every time you see them is like, should I stop? Because a fast no is probably a little better than a long yes. And I'm not sure about that. And I'm not sure which one comes first. But a fast no is great because it allows you to move on and focus on something else. And as entrepreneurs, you're not going to have one idea. You're going to have an idea that you think is really effing good, and it's the one you're going to chase. But I find myself now with like, oh God, no, that's a really good idea, but you are going to forget about that right now because you got to maintain a focus. If you're an entrepreneur and you're in the space, you're always going to have ideas, and don't be afraid to deselect a bunch of them. Run with one for a while because it's going to be a great experience, and if that doesn't work out, you're going to do it again. I mean, if it's in your blood, it's in your blood. But the whole point of having the network around you and having friends, peers, is to kind of quickly give you the signals on the quick no is a wonderful thing.
I think organizations like Launch New York, Skyly can definitely help with that. But that's kind of what they're there for. give you that early no or help you keep going. This is a very, very serious question. If you could have one fictional character on your team, who would it be?
I'm glad you asked me that this afternoon. You kind of gave me a heads up and just saying, you know, here's some of the questions, and I only looked at one and I went, oh God. But the answer
you already talked about the underwear gnome, so
the underwear. No, and the answer came quite quickly. Can I give a couple of background stories that will actually kind of lead me up to?
Yeah.
So a lot of you still may not know what we do. We're, you know, a healthcare informatics company that's figured out how infections move through a hospital. So there's some background here. Let me go back to 1854. So I'm going way back. And my grandfather came over. No. So 1854, there's a cholera outbreak in London, England. And up to that time, everybody thought that cholera was caused by noxious gases. So you're living in a big city, people throw sewage out the window, you're surrounded by noxious gases, people would walk around literally with their nose plugged so they don't get cholera. 1854 was a horrible outbreak of cholera. It was just rampantly killing masses of people. And a guy named Dr. John Snow did something weird. He went up to a map of London in this neighborhood, and he put a bunch of pins into a map where all these families lived and these cases were discovered. And right in the middle of that cluster of pins was a water pump. So in the middle of the night, he went into the community and he removed the handle on the water pump. And 2 days later, cholera started to disappear. So there's a great Bob Dylan lyric, the pump don't work because the vandals took the handle. Dr. John Snow was the vandal that took the handle. He stopped the cholera outbreak in London, England. He also, by the way, started with that process of putting dots on a map, started the science of epidemiology. He was the father of epidemiology, which really sort of started a whole branch around the study of infectious diseases and how they transmit. So fast forward to 2015, I think the evidence around what are the water pumps in the hospital to date sucks. The evidence that the only real solution is staff should wash their hands more is almost laughable. But nobody has really looked at the problem before and tried to think outside the box and ask the question, what are the water pumps in the hospital? And that's a really complicated question. And so the second part of my story is, as a company really that's interested in big data and solving problems in healthcare, one of our first stops was IBM. And we got shuffled through to talk to the Watson group. And the Watson is this massive cognitive computer, beat everybody at Jeopardy, the smartest chess player in the world, and now they've turned their attention to solving the problems of healthcare. We're going to analyze every single piece of data known to man, and we're going to solve the problem of healthcare. And one of the things that Watson was looking at was, and they were proud to show us, having signed NDAs, I can't say too much, but they've studied the hell out of staff hand hygiene and staff hand hygiene compliance. And Watson was there just crunching the numbers, like, you know, being the art of deduction, this is that. And we're sitting there, we're just going, Jesus, we're Sherlock because you're looking at the wrong thing. You're not looking for the water pump, you're looking for the noxious gas in the air that is leading these infections spreading through the hospital. So wouldn't it be great if we could be, as a small company, the Sherlock to the Watson? And so to answer the question, you asked, the fictional character for us is really, you know, that analogy around clue or finding where these things are coming from and then applying how to solve it. We really do want to be the Sherlock of the space. And there's a remarkable quote that we've used before to describe really to those who can't understand why we've taken the path we've taken. And we've been ridiculed, and we've been, arrows in the back. There's a lot of time invested in making staff wash their hands. And there's a great quote from Sherlock Watson, is when you remove the impossible, whatever's left, no matter how improbable, is the truth. And so we have spent so much time, so much energy removing the impossible, proving that these things really have no bearing on the size and magnitude of the problem. We found the improbables, which is a series of water pumps inside the hospital, and we found the truth. And by finding the truth, we're now in step 2. We've collected the underwear. We're in step 2, and we've made all the right steps, one of which is moving to Buffalo so that we can get to step 3.
Talk about Toronto, you talked about Mars. What are some things that you see in the Toronto startup ecosystem that maybe Buffalo could adapt and could learn from?
Yeah, it's a long journey. So Dig is how old? How old's Dig now?
1 year.
A year.
A year and a month.
A year and a month. Congratulations. And the community has really kind of formulated over the last 18 months. Like, I really kind of sensed a big change. I wasn't here before, but how much has it grown over the last 18 months? Have you hit the hockey stick curve? Or are you still?
I don't know. What do you guys think? I think we're
have you sensed the change?
We're on the curve. It's like that.
It's a long-term proposition. Momentum is going to build fast. It's going to build faster here than in Canada. But really, I think that startup community and developing a startup community in a big city was really a 5 to 7 year challenge. And that's still ongoing, but a lot of mistakes were made in the beginning, and it's really like, how do you interface with people that are interested in becoming entrepreneurs? What is the culture of entrepreneurship? And how do you respond and support that? And here's the big challenge, and especially in healthcare. And I got my healthcare hat on because it's the space that I know best. It's great encouraging everybody to come up with big ideas, big thoughts, and then addressing the challenge and the problem. And the challenge in Canada was, in Toronto, was like, we come up with all these great ideas, we've got all this IP sitting on the shelf, we're on academic hospital row, we've got universities all around us. God, are we ever crappy at commercializing? And these companies that are having these brilliant ideas are not getting funded. Well, what VC worth their salt is going to invest in a company that's had $500,000 worth in research, but almost 0 sales? So innovation, we have to really separate what innovation is to make this community really worthwhile. I would sort of say R&D is R&D. Innovation is really commercialization, the early stage of that. It's when you take all that hard work from the labs, it's all those times spent figuring stuff out in lab coats or in front of the computer. Innovation really happens when you start selling what you've got. And the challenge, certainly from the community in healthcare that I'm coming from in Canada, was there's very few buyers. You were essentially kind of approaching 1 or 2 buyers that had a lengthy RFP process in healthcare. If we really want the community to be successful here and accelerate and catalyze ideas, you need and I'll just pick on the hospital systems here, is we've got 3 or 4 hospital systems in the area. We've got the Catholics, we've got Clyde Health, ECMC, Roswell. We can open up the umbrellas as we go outside of that. If nobody's buying your shit, you'll never get invested, you'll never pay for yourself a good salary, you'll never invest in people, and that's a cycle that can't be broken if you're not good at sales, if people aren't buying your stuff. The risk is that you come up with a great idea. The risk to Buffalo is that you come up with a great idea, you figure out how to sell it in another market, and you end up moving to Cleveland or Pittsburgh or New York or North Carolina to better support that idea in the company. If Buffalo really is serious about growing their healthcare market, they're going to enable the healthcare institutions, providers, if you're in the healthcare space, to pay money for your stuff so you can go out, you can show investors that I've got traction, I've got sales, and we're worth investing in. We're going to replicate this model in a number of different markets. If the payers in the system, whoever they may be, aren't going to step up to the plate and aren't going to invest in innovation, you got a long road ahead of you. Not to say it can't be successful, but that support's going to come from other areas. It's going to come from the state, it's going to come from philanthropy, foundations. It's not going to mean as much as a hospital or healthcare provider plunking down money and paying you for something you've invented and developed that's going to help them.
This is the question that I ask every speaker. Is my last question for you. Simple. If Buffalo is to succeed, it needs more of blank.
If Buffalo's the seed, I wish I'd read these questions before I walked in. So I think you've got an amazing starting point, and again, I've got the healthcare hat on, just because it's the space I've been in, and it's what I've been living here in Buffalo for the last year and a half. You have got the infrastructure, you've got for-profit or not-for-profit healthcare systems that really care about their bottom line, they really care about quality, it's a competitive market, they need to differentiate, they need to show success. The government pressure on them these days is amazing. And where healthcare is going is out of the hospital. So if you've got a solution, or you're thinking about a solution right now, which actually deals with the healthcare continuum or services outside the hospital, or can shift the needle towards lower cost services in the community, you're onto something. And I would run with that. Because you're up against kind of budget pressures in some other institutions, unless you're really kind of nailing a problem that they're dealing with. So you've got a great community here. The community leadership is just amazing here. Buffalo is one of these weird communities that's been described to me as, you come to Buffalo, it's unlikely you're going to leave, or if you do leave, you end up coming back here, and that seems to be a story that's repeated over and over again. So you're going to have a lot of successful people in the community that have done this before, that actually want to be in the community and want to help. I think the challenge is kind of filling that gap, and there's money in the community as well. I think there's a lot of money that is looking for a place to invest. But it's a little risk averse. And if that's the conditions, then nobody's going to invest in Buffalo companies if they're not generating sales in their own backyard. So I think the challenge to Buffalo is to kind of look at the whole system together, from the entrepreneurs through to the payers and the funders. Healthcare 2.0, honestly, your challenge is to bring all of those people around the table. It is to ensure that everybody is making a similar commitment in innovation and in entrepreneurship. There's a massive amount of pride in this community that strikes Canadians as a little odd, because we're a little bit more reserved or passive aggressive. You're certainly not passive down here. And I think that's the opportunity ahead of you. So it's really talking more about the system and not just focusing on entrepreneurship as a goal. And it's doing it early enough so that the rising tide is going to raise all boats. You just don't have one thing happening in absence of another. If you can address the system together, you're going to have faster startups. You're going to have better success faster for startups. And that's going to create a lot of momentum in the community. If it was easy at this point, coming from Toronto, amongst my peers, I can list the top 3 success stories coming from our space. It's really easy to do, to point to the companies that have just absolutely killed it. I think if you've got the same question in Buffalo right now, I don't know if there's anybody you would point to right away. Our goal is to make sure Infonaut is at the top of the list if there's not already a number one. But it's really that kind of building the community and not just focusing on the entrepreneurship thing, because having ideas is lots of fun. It's a creative exercise. It's really exciting. It sucks sometimes, but it actually breeds a community by itself, because there's so many exciting things about being an entrepreneurship, and misery loves company. You like to suffer with other people. If you take a broader perspective from the beginning, you're much better poised for success across the whole market.
Awesome. That's all the questions I have for you. We're gonna open it up to the audience. I'll bring the mic around. Does anybody have any questions for Niall? We answered them all. All right, we're running around. Sorry, Charlie.
Hi. I was just curious to know, how much of your outreach do you network with the insurance companies? I know you talked a lot about making inroads with the hospitals and healthcare systems. I was just curious to know from the payer perspective how much of your outreach is with the insurance companies, where the money is kind of funneling from customer to insurance company and eventually to the hospitals.
I think that's a great question, and to be honest, I'm just trying to figure out. I will admit, I'll tell you a story about the evolution of Infonaut, which kind of proves that I'm not the smartest person. On a stage of two, I'm usually the second smartest person. So the story of Infonaut is, we realized there was a problem. So taking a big data approach, we measured the hell out of it. Then, and we celebrated, hey, we can measure. And that was a huge milestone, and then we found out that nobody pays for measurement. Then we said, okay, we have all the data, let's figure out what these water pumps are. What is the knowledge we have from that? And that took us about a year. And then we had a huge celebration that we were the smartest people on the planet in our space. And then realized that people don't spend much money for the smartest people in this space. Unless we wanted to build a consulting business, we didn't want to do that. So then we developed a number of what we call patient safety innovations or interventions, things that we know needed to be changed, and we ranked them. Like we drew sort of a grid, and we said, what's easiest and most effective, and let's take those into a hospital. And we had a big party to celebrate that we had invented all these things, and we popped some champagne, and then we found out that nobody pays for smart ideas. Unless we were a consulting company, we didn't want to be a consulting company. So then we realized that when we got down to the States that, hey, the ultimate metric for what we're doing is infection reduction. We got to do all this stuff, but we got to prove that we can reduce infections. And we did that, and we had a big party, and we celebrated, we popped some champagne. And then we went and saw a hospital executive, and we said, hey, we reduced your infections with the smartest people on the planet. We can measure the hell out of this shit. Let's go for round two. And they went, we don't make a decision without understanding how it impacts our cost per case. So we went, oh God, now we got to figure out how we reduce their costs. So we went away, and we figured out how we reduced their costs. We had actually a lot of help as well. Somebody's in the room. And they told us, hey, we reduced their costs X%. It was a huge number. We were like, so we had a party, we popped the champagne, we celebrated, and went and presented the results. Hey, we reduced your cost per case. Let's go for round two, big expansion. We're going to do the whole hospital, millions of dollars. And then the next question came up, said, yeah, you know what? Reducing costs is one thing. I'm really concerned about driving revenue. And we're like, oh, for God's sakes, when does this end? That's where we are right now. So the challenge is it's great you've reduced costs, you've saved lives, you're really smart, blah, blah, blah. How are you gonna make me more competitive to my customers? And a big part of that, how do I drive revenue? A big part of that is, and this is coming from another healthcare system, we know that US hospitals negotiate individually the rates with the insurers. So now we've got to be able to prove to the insurer that this hospital was smarter and better and higher quality that allows them to get higher rates, which will finish the story. So I'm going to pop a bottle of champagne, and then somebody is going, I don't know what comes after that. There's something, I know it's there, I have no idea what it is, but we're going to go and celebrate success, and then someone's going to, hey, that doesn't matter so much, what this really matters. That process also taught us, as we were kind of learning about insurers, that, hey, we're solving this problem for hospitals, but government is also throwing a ton of money into this space, and insurers are right now, they're running the system, and you guys will look a lot more like Canada in a few years than you do right now, because the government is such a large payer of healthcare, and the insurers are actually making decisions. So on the whiteboard is, we figure out the hospital space as much as we can right now. We've got to figure out government, we've got to figure out insurers in order to unlock maximum value of what we're doing. So.
Time for one more question. Charlie?
I imagine you're going to say you'd have to kill me if you told me, but I'm really wondering, can you give us any clues on what the secret sauce is? Where are the water pumps?
Oh, you want me to tell you where the water pump is?
Or at least give me a hint, yeah.
Well, I'm a businessman. Sure, I'll tell you, but listen. What I will share with you is, I'll tell you how infections move through a hospital. Infections, and don't laugh when I say this because it turns out it's pretty simple. Infections don't move themselves. Infections move around a hospital because people move them around. So ultimately, and imagine the shock when we learned this. Here's a big data guy that's really into healthcare IT that realized that, oh crap, the problem is really behavior. Now I gotta be in the change management space. I gotta change behavior. And nothing is harder in this planet than changing behavior. You learn how to wash your hands when you're 2 years old. And that doesn't change. And I think, listen, I'm ultra aware of the problem, and like I'm not a germaphobe, but I will say that when I go to the bathroom and I'm on my own, I wash my hands maybe 85% of the time if I'm really careful. And if you have an honest conversation, people say, I'm 100, no problem. When we measure visitors washing their hands beside the ICU in a hospital before they go in and touch their loved ones who are on immunosuppressant drugs, who have open surgical wounds, who are extremely compromised, visitors who mimic the general population, wash their hands. I would say if you have a day where it's over 35%, you got a good day in a hospital. So this flashlight, so the World Health Organization has said, you want to stop hospital-acquired infections, staff are going to wash their hands at these 5 moments. And we're going to track them and report them. Turns out those 5 moments make no sense at all. Turns out that most staff in a hospital actually know what they're doing. They're highly trained individuals that are in the profession because they care, and they kind of know. So all of the attention has been put on staff, who are mostly pretty good. There's some room for improvement, and we've entirely ignored the rest of the population in a hospital that is the problem. And most of these superbugs are fecal oral. So they go in through the mouth. They come from feces. The sort of C. diff it comes from feces, it goes in through the mouth. Nurses have a great saying. My patients touch 3 things: their privates, their food, and their mouth. There's the germ. Nobody has ever talked about patient hand hygiene. Nobody has ever talked about visitors. Another kind of slight story, if I've got a couple of minutes. If I was going to invent the ideal environment to spread infections, so let's just flip the page. I'm going to design the perfect place to spread infections. I'm going to build a building that's not that clean. I'm going to put a bunch of sick people close together, move them around, touch them a lot, cut them open, give them antibiotics. I got a hospital. We have the ideal environment to spread infections. And we're really not doing anything about addressing kind of the root problems around how infections move around. And that's, so I won't explain sort of the full secret sauce, but just by stepping back from healthcare, stepping back from hospitals and saying, how do infections move throughout a hospital? Kind of being non-hospital people, we're public health people. I came from finance. I got a crazy PhD guy who's a knowledge information system design guy. I got kind of some guy who's a digital strategist. We hired some crazy Russian guys who were coders. There was very little healthcare experience in the company, which wasn't great, but it made a difference in the end. We took a step back and we said, what's the problem? And we followed a different path.
Awesome. Well, that will conclude the startup grind. Niall is going to stick around. You're welcome to the beer and food if there's any left. I think there's some left. Next month is Anthony Johnson, Empire Genomics. Buffalo company came out of Roswell Park. They're mapping the DNA inside your body. So pretty crazy stuff. Niall, thank you so much. Tons of great information. Let's hear for Niall. Thank you all for coming.